Hello, I'm Dr. Bill Wyatt. I'm a general dentist, but I stopped doing everything but orthodontics in 1970 and have continued with that throughout this time. Uh, I'm a member of the American Orthodontic Society and I'm board certified in that. And this is a group of dentists in this society that are pedodontists and general dentists and a few orthodontists related to regular orthodontists. And we are dedicated to teaching general and pediatric dentists or any other dentists that are interested in orthodontics how to do good orthodontics. We have a wonderful organization, the AOS. We have board certification in the AOS, and you go through steps going up through the board. We have a good journal. We have annual meetings and other meetings also throughout the year. Uh, it's just a good organization to be in if you're doing orthodontist as a dentist. Uh, and so I recommend doing that. We have a lot of dedicated teachers that'll take you by the hand and take you through orthodontics gradually. It'll take you a while to really learn it. Okay, today I'm going to cover a thing called abscessed teeth, or how we can use abscessed teeth in orthodontics. When you get into adult orthodontics, it gets a lot more complicated, and so we we recommend you know how to do that because you can really help people out like that. And the effect of these abscessed teeth, they have little granulomas at the tip, and maybe they get big, and they're similar to cysts in a way. But if you really need a tooth there, and the abscess comes from the inside of the tooth, then it can be treated endodontically, and the tooth can be saved. Now, if it's something from the outside, the periodontal situation, it's a different ball game, as we will show in this first case. Well, actually, I'm just going to cover one case in this, and we'll try to go through it as quickly as we can, and so you get the point of what we're trying to do here. All right, this particular case, it was caused from the inside of the tooth, so I sent the patient to an endodontist who fixed it real good, and the abscess or the granuloma at the bottom went away, and the tooth came back down. Here is what the tooth looked like in treatment when we started. I mean, the thing was actually floating, and this was bad, and it drained out up here, had a drainage coming out. You think, well, God, this is a mess. You can't possibly use this, but we really needed this tooth to help level this bite. I mean, it's a closed bite case. We really need this. So I sent this lady in to have this, and they did root canals and got rid of the infection, and this bone filled back in this area down here, and the tooth, we got it back down level with the other teeth, and we used this tooth in actually opening the dental bite in the front part. Just watch what happens here. Okay, here we sent it in. I didn't get this blown up, everything, but they did the root canal and they crowned the tooth, and you can see the bone is filled back in, and this tooth is functioning relatively normal now. This is after we finished the case. The Panorex taken after we had opened the bite on the case. But this was a real deep bite case. The upper teeth came way down here. The lower teeth came up the roof of the mouth. I think I've got a Panorex here. I'll show that to you. Here's the lady's face. That's a kind of a bleached out picture there, but you get the idea from it. And she smiles, she's got a kind of a gummy smile there. And you can see if you bring these teeth together here on the side, these front teeth are going to just virtually cover up the lower teeth. This is a real class 2 division 2 type situation. Now this abscessed tooth is floated up here where it's in contact. It's just bobbling up and down. You'd think, well, this hopeless, we got to get rid of it. But then you'd have had to either put an implant or something back in here, which really wouldn't be as good as this tooth if it can be treated endodontically. Now, let me see if I've got a picture. That's a little clearer picture. This is 1989, the 5th month of 89. You can see where the wear facets, where these cuffs come down and touch this area. So she does some pretty hard chewing. If you close these teeth down here, these are going to come way down like that in the mouth. So it's a real deep bite, class 2, division 2 type case, you see. And you don't want to take any teeth out on these class 2, division 2 cases. And if you straighten these teeth out, this lower jaw just invariably will come forward a great deal of the way. And the correction in class 2s in class 2 division 2 is really not very difficult when you raise these teeth up and they're kind of angled out here, and then you intrude these and you intrude these too. As you pick them up from out here in front, they'll actually torque themselves out as you do it. And they're the orthodontic treatment. It's not all that difficult to do. You look at it, and if you haven't done much orthodontics, you say, oh my God, you can't do it. But you level that bite out, and about half the class 2 goes away. In fact, I've had them where I had to put some class 3 elastics on one class 2 division 2 case one time to finish it up. It went past class 1. Okay, here again, looking at this tooth where it's floated up, you see, and we'll get it treated, and then we're going to intrude it, and we'll use it to intrude this. We put an intruding wire on there which comes way down here. We bring these down, and one that goes up here, and it picks these teeth up. Here, we've got a video on these intruding arches. That's one thing that speeds up your orthodontics. It really does shorten your case by 2, maybe 3 months if you really learn how to do that efficiently. Now the case is all tucked in, the teeth are all leaning in like this, and it's narrow in here. We'll expand and bring all that out, and that works good. There's a mirror stuck in the mouth to do this. So, let me go back here again. Now the lower, you can see we're going to expand it too. It's kind of got this narrowness in this area, and we hope to bring this out more, kind of bring our arch form out. You can see this tooth is kind of floating up, and this is a drainage area right in here where they actually pus drains out of that wing, and it'd been there for a long time, just a big old kind of a cyst back there. The tooth is, you can just push on it and go up and down right here. I'm sure it pumped the bacteria into the bloodstream every time she chewed on the thing. So we got the endodontist to treat it, and this cleared up, and the tooth cleared up and got good. So we went ahead, with the orthodontic treatment. So here it is treated now, and I don't think it's level yet, but it will get level as we come out, or maybe it is level pretty good there, so I can't see it from this Panorex. And that's the tooth, and there's the kind of the picture of the x-ray from the side, and here is the, you see where that came up through there, here it is there where it drains out, and you look at that and say, oh God, that's terrible. But if you took that out, you'd have to put in, treated it properly, you'd have to put an implant, and putting an implant and a crown on the implant and all this costs about as much as it does to do the holder and orthodontic case. You know, not quite, but it'll come pretty darn close now, what they you're charged for that. Now, this is a little later. We've opened the bite. I think I jumped one there, and we've got it leveled out now. We've got rectangular wire in there, so we're torquing these teeth out pretty good, and we'll get them torqued out. We'll get this into class 1 during the treatment and everything. That's from the side. It's still not class 1. We'll have to kind of pull this forward some and take this back maybe some to get this cusp going down, the bicuspid going down in that area. Hope we did treat it properly here. Let me go ahead with these slides. But we've got the bite open. Now she's not doing a real thrilling job of keeping the teeth clean while we're going along here. So we'll have to see that she gets in or gets somewhere and gets these teeth cleaned real good. Now, after some, seemed like we banded this tooth and actually used it in the treatment of the orthodontic case. We've got the second molar banded over on the other side here. Everything's going there. Let me see what we put on. I thought we banded that tooth, but this is leveled out now. Now that's getting pretty close to class 1 in here. You have to torque these out and then slide this further out, you see, to finish it up. Now this side we've got to close some space and level this a little better. Tooth still looks to be higher over here than this tooth, so we may have to drop this down some way or another to finish that. Still not looking real good there. It's lined up now, and we've kind of changed the arch form. You notice it was pretty narrow at first, so we've kind of developed that out, both upper and lower arches. Now this lower one looks a whole lot better if you remember how narrow it was to start with down in here. And now it's looking quite good. And we do have this banded, and everything is in there. It looks good. The arch form's good. We can get it fitting together good and put retention in there that'll allow it to erupt together. Now, that's coming along pretty good. We've still got to get this down in the back here. Still not leveled out like I would like for it to be, but it's looking quite good. The arch form, everything's working out nice. Now up here we've got the second molar is down further than the 6-year molar, and that may be what's keeping that from going like I'd like for it to. Well, it's looking good now. This tooth is about the same height as this one, and everything looks good. The arch form is really good. I like that, and it will be fitting in. You see, keeping this lined up right across here is good, and we came in and we made a little cuspid inlets in the arch wire that brings the cuspid out a little more. These bands, brackets that are supposed to have all the in and out and everything in them, they don't. Sometimes you get a thicker, thinner cuspid or lateral, and you have to kind of adjust with some bends, some in and out bends, and you put torque in them if you need to. And you need to learn how to bend the wire. Just go ahead and learn how to do it. Don't think you can do all this stuff with these preformed arches and pulling them out and stick them in and expect them to turn out good. They'll turn out, but they're not really good. And I know a lot of orthodontists, a lot of general dentists and pedodontists use these preformed arches, and they don't know one thing about bending proper arch wires and putting them in there. You can make those teeth do just darn near anything you want them to. You can turn them any way you want. You can tip them. You can just do so many things if you'll just learn how to bend the arch wire and well, what it does. And you're not going to learn that overnight, but it can be done. And here's the lady after we finished up. She's got a good vertical height to the face. Everything looks nice, and her facial structure's balanced out. Looks good. I hope she's got a better gum lines, but it seemed like her teeth were kind of low, and you do see gum tissue there, which is very difficult. Now, I take people that have these high lips like this and have them stretch those lips down, and as you get older, if you pull these lips down over, if these platter lip people can make them grow out like that, you can sure stretch them. And I remember as a kid when I was having my teeth straightened, my mother worked for this orthodontist, and he had me pull my lip down over my teeth and just keep stretching it. And now that I'm old, you don't see my front teeth very much. When I smile, you can see the teeth, but it is stretched out, so you can stretch that lip out some, and it'll look better, and it makes you smile easier if your lip is worse. So that's a pretty good thing to do to finish up a case. Now there are the teeth that look pretty bad when we started. And I don't know whether I've got a model shot or not, but that's good class 1. The case looks right good. When they close all the way, this should be in contact, or teeth will come in contact. This abscess tooth that was floated up here is settled down in that area there. And the arch form is certainly better than it was to start with. And the tooth looks healthy, and there's no infection getting into the body from that point. She's taking care of them a little better now. I wish she would do it better. Now here it is, 95. This is, I remember that was in the 80s when we started. But 95, this is holding up. Little midline deviation, maybe the jaw's a little to one side. This is a bigger opening over here than on this side. But basically, several years after we finished, looks pretty doggone good. And we bonded a 3 to 3 on the lower anterior. that abscessed tooth looks perfectly normal in this area. It fits in very good, and we're using it, and it's possible she could use that tooth the rest of her life. Now I'm going to have a video on, with a lot of endodontically treated teeth, and we can move them all over the place as long as they're healthy and the root structure on the outside's alive, and we can move endodontically treated teeth almost just like this regular teeth. Now they could become ankylosed probably easier, but most likely it's not. And the arch form is good, and that tooth looks doggone near normal in there. You would not think. And here's the lady's facial structure. Looks nice. She's got a little short chin, and she's got a tapered back like that, but everybody doesn't have to be straight up and down, so don't think she may not fit the cephalometric analysis exactly. They don't have to. People don't have to fit all that cephalometric stuff. So that's the tooth later on. That's 80. It was 89, I guess, when we got started on the case, and you could kind of, but I don't know that. I can't tell. That may be the abscess on it there. And temporomandibular joints were doing okay. She didn't have any TMJ problem with this. Now here is the first Panrex, I guess, when we started, and she had the deep bite. You can see the teeth closed over, and this thing was all just like a cyst, almost looked like it's getting over under this tooth too. I can't tell for sure this X-ray for that. So let's see if I've got another. Okay, here it is after the root canal was done on the tooth, and the tooth is healing good, except it's still high, you see right here. It came down, or the two teeth lined up in here and leveled out perfectly fine. The treatment. There it is in the treatment process. The bone structure's filling in. Looks pretty good down here now. So what I'm saying here, don't throw up your hands and give up on a tooth or something. And you can, if the abscess came from the inside, you can do it. Now if it's a pocket and abscess from that, I mean, you can't. I mean, well, I'd say you can. I guess if somebody took enough effort to, but they might, but that'd be really shaky treating one for that. And this is 91 there, and that's 91 again. Now here's 93, and you see the tooth is leveling out pretty much in there now. And we finished, we got a 3 to 3 in. And this is another 93 deal. Can't see the date on this one, but I think it's 95 or somewhere in there. Alright, well, I do have some model shots. You see how the teeth are angled in, and you don't even see the lower anterior teeth. You don't even see them right here. And the class 2, this tooth comes back to there. This one comes back to there. We angle the teeth out, you see. The cusps are lined up. This is not a straight side shot like this is a side shot here. If I stuck a mirror in there, you could see it better. But this is class 1 side. The teeth are angled out this way. Here they're angled this way. You move the teeth out, raise them up, and this jaw comes forward in there. And this is not a difficult type of case to do. So if you're just starting in orthodontics, if you learn how to do Class 2 Division 2 cases like this, they're really not difficult once you get to use it. You got to learn how to torque teeth, though. Now just elevating them will tend to torque them. So these intruding arches that we teach you how to use, they come way up here, they fit over your other arch, come to picking the teeth up. Torque the teeth out as they come up, they torque these out as they go down, you see. So whatever you want, when you get them like you want them, just tie that thing back and hold it there. So this is I would say, a successfully treated case. And if she uses a retention that we know how to put them in, we put wraparound retention. We don't put any wires over the teeth. We want the teeth to erupt into each other freely. We don't want them going in one at one time. When the retainer's in there, they're hitting a wire, the tooth moves one way, they take it out, it moves back the other way. And that has nothing, that will always fail down the line somewhere. So learn how to put a good retainer in there. We'll teach you how to do that in this. So here it is in 1995, and it's holding up good. And I would expect this woman will have, here it is 2016 now. And I'm getting older, but I'll bet you this lady's teeth are still nice and in place. And that's where it was to start with. You couldn't even see her lower teeth. Look how much better that is than what you see back from. Now when you can chew properly, and you can move your jaw from side to side and chew much better and more efficiently with this type of a dentition. And this can last. If I could live as long as my teeth would last, I think I could be 150 or 200 and still have them. I have teeth that I've chewed and eaten on all these years, and they're still good. And this lady can have these teeth when she's 100 years old if she wants to. She'll take care of them. And that's where now here you have to chew straight up and down. You don't have any choice. You have to eat like a dog. It's bite straight. You can't grind the food up like you really should. So it makes a difference in the digestive system over a period of time. And there's the arch form, and you remember we changed the arch form. And this is much bigger than this. One of them's closer than the other one. On the lower, this is like it is now. That was 89. This is probably 95. All right. Okay. This is using abscessed teeth. And you can use them if you get a good root canal done and it's coming from the inside, not from the periodontal side. Then you can use these teeth. And I would think that periodontally treated tooth could last this lady indefinitely if she'll take care of it properly. So I'm going to close this little video out. I can get over here to the other side and stop it.